Let's now review the components and clinical neurology of the diencephalon, some of the components of which we've already reviewed as elements of other neural systems. Starting off, as we talked about when we developed the neural tube, we know that the diencephalon consists of 4 distinct parts of the CNS, all of which end in the word thalamus. And they are the thalamus proper, which is our series of motor and sensory relay nuclei, the hypothalamus, which is closely tied with control of endocrine and autonomic function, epithalamus, which we'll see again is the pineal gland, and finally the subthalamus, which is discussed as a component of the basal ganglia. First off, let's look at where the diencephalon is specifically located in a medial view of a mid-sagittal section through the CNS. Note that in this view, we are showing the cut edge of the third ventricle that I'm encircling by the pointer, and all of the components of the diencephalon are literally embedded in its lateral wall, because as we pointed out during brain development, the diencephalon surrounds the narrow third ventricle. All right, and then the largest component of the diencephalon, which is largely football or egg-shaped, is the thalamus. Situated, and as the name implies, just below the thalamus is the hypothalamus. Note the close proximity of the hypothalamus to the optic chiasm, the pituitary, part of which is an outgrowth of the hypothalamus, and the mammillary body, which is the largest, most grossly visible component of the hypothalamus. Then we've talked about, with regard to brainstem anatomy, the pineal gland, a major component of the epithalamus, and how it is suspended over the area of the dorsal midbrain in the region of the superior colliculus. And finally, the smallest part of the diencephalon is the subthalamus. It's situated about here, just above the rostral end of the midbrain, and as we said, is a component of the basal ganglia. All right. In parentheses on this slide, I have noted some of the clinical features that are associated with diencephalic structures. As we'll see here and also in the limbic system review, the mammillary bodies are major players in the limbic system, which is associated with memory consolidation. And for some unknown reason, as we'll see, mammillary neurons are sites of a preferential degeneration in patients with Korsakoff psychosis, which is a late-stage manifestation of chronic alcohol abuse and the related thiamine deficiency. The pituitary gland is subject to tumor development, usually in the form of a craniopharyngioma or a pituitary adenoma, and regardless of the form of the pituitary tumor, that tumor is likely to compress the optic chiasm that is situated and suspended directly above it. And then finally, we reviewed this with brainstem, but we'll see it again here. We'll remind everyone of the significance of a pineal tumor and the fact that the neurology that it presents with is associated with the fact that it's compressing the upper part of the midbrain in the area of the superior colliculus.